D-dimer. This is a word which was taught to us by COVID. The whole country became obsessed with this test. But do we understand what D-dimer is? So basically, whenever blood clots inside our body tries to dissolve it. And in that process, the end product which is formed is called D-dimer. Hi, I am Dr. Ankit Jitani, consultant hematologist and stem cell transplant physician at Apollo CBCC Cancer Care, Ahmedabad. Deep vein thrombosis. This is clotting of blood inside our blood vessels. In normal physiological state, blood should continuously flow in our blood vessels and they should not clot. Any factor which leads to increased clotting of the blood in our body leads to deep vein thrombosis. So the blood can clot inside veins as well as inside arteries. The causes of blood clot in vein and artery are different. Whenever blood clots inside our body, what we need to understand is the blood clotting spontaneously or is it happening because of any provocating factor? The main causes of spontaneous blood clotting are certain genetic issues, certain autoimmune diseases or underlying cancer. If these are present, the body do not need a stimulus for the blood to clot. Clotting because of any stimulus happens mainly secondary to any trauma, any surgery, any injury. Injury as trivial as playing football, falling down may lead to blood clotting. So we divide clotting into three types: spontaneous, unprovoked and provoked. So among the provoked clots, the provocating factor can be a trivial trauma and a major surgery. So how can we prevent blood to clot? So in case of a genetic glitch that makes an individual susceptible to DVT, we need to take certain precautions. There are other confounders like diabetes, hypertension, pregnancy, obesity. These can compound the risk of blood clotting in any individual who is already genetically predisposed. Among these, the modifiable factors are diabetes, obesity, hypertension. We need to keep them under check. Number two, all these individuals, when they lay dormant for a long time, there is increased propensity of the blood to clot. So when you take a long haul flight, keep walking around, keep exercising your calf muscles, make them work so that the blood do not remain stagnant. So among the provocating factor, the major one which is really concerning is cancer. So a lot of cancer of different body organs can lead to thrombus. The major ones are solid organs like pancreas, like cancers of the female genital tract, of the gastrointestinal tract, as well as blood cancers like lymphoma, multiple myeloma. These increases the propensity of an individual for the blood to clot. And a clotting happening in this circumstance is, number one, it can be a pointer towards a diagnosis of cancer. And number two, it does make treatment of cancer difficult. So we should not be ignoring any symptoms of clotting. Now this brings me to what are the symptoms of blood clotting. So number one, if it happens in the leg, the most common symptoms is pain, swelling, redness, discoloration. So if we notice any one of these, and especially if this is limited to one of the limbs, it is a red flag sign. The blood clot can also happen in the abdomen. The portal venous system of our blood may clot, which can cause pain in the abdomen, it can cause vomiting, it can cause difficulty in passing stool, or it may cause diarrhea with loss of blood in stool. Clotting can also happen inside the brain, which can cause loss of consciousness, seizures, and lot of other issues. Clotting can also happen in the hands, again causing problems similar to what happens in the legs. So if a clotting happens, what should we do? Number one, and the most important, is we should see a hematologist. Because as we discussed, there are multiple causes that can lead to blood clot. We need to find the cause because that is very essential in deciding what form of therapy the patient needs and how long the therapy should be continued. So if clotting happens, the patient is basically put under some blood thinners which are called anticoagulants. There are different types of anticoagulants. Some are injectable, some are oral. The doctor chooses what is the best for the patient. The difficult decision in treatment of blood clots is when to stop the anticoagulation, and that decision is dependent on what disease the patient has which has provoked the thrombus. The anticoagulation is definitely continued for a period of 3 to 6 months, after which we take a call basing on the risk of recurrence of the thrombus and the risk of bleeding in the patient. Based on that, there are patients, subset of patients, who need to continue the drug lifelong, and there are certain group of patients in whom we can stop the therapy in 3 to 6 months. So in blood clot, excellent treatments are available now with advent in the pharmacological therapy for blood clotting. There are drugs which can be taken without constant monitoring, which was required previously. So good therapy is now available in our country. It has become relatively inexpensive as well with advent of multiple generic form of therapies. What is important is you should be aware, you should see your doctor, you should get a diagnosis and decide when to stop the therapy, which is the most critical information in DVT. So that's all I need to say for today. See you. Thank you.